Hi there, I'm Dr. Stephanie Falk. And today I want to talk a little bit about the question, how long should therapy take? I think that there's some misconceptions out there. Why do some people come in and meet with a therapist for 1 to 5 sessions, for 8 sessions, for 10 sessions, and other people come in for 16, 18, or 2 to 5 years? I mean, what makes the difference? And is the person that's coming in for, 5 years meeting with a therapist, is that therapy just not successful? Or does it take on another shape and role in that person's life? So I think that the best way to demonstrate the various time frames around therapy process is to talk about 2 parallel examples. I was 10 years old and I was challenged by my buddies next door to touch the basketball net. And I remember being vertically challenged that I ran to the end of the street and then I ran as hard as I absolutely could to try to touch the net. And I landed wrong and I broke my ankle. And so I had this really intense injury with a lot of emotion around it and a lot of pain around it, and I needed immediate attention and care. But once I got that immediate attention, once I was on the pain medication, icing as much as I could, once the cast was on, really the problem was resolved. Once that cast was cut off, sure, I needed to work a little bit at trying to build back some muscle mass and being able to maneuver my ankle, but for the most part, I didn't have any long-term implications. So there was a lot of care up front, and then there weren't long-term implications that impacted my day-to-day life as it related to that broken ankle. Compare that with someone with an autoimmune condition. With someone with an autoimmune condition, usually in the beginning, there's a lot of appointments, trying to understand the differential diagnosis, trying to really hone in on what is the diagnosis, what is the treatment plan, what's really going to work for this person to help mitigate their symptoms. And so there's a lot of meetings up front. And then as that person seems to manage their symptoms well with the treatment plan, what happens is they start to lengthen out the time between appointments. But that person doesn't really stop going to the doctor. They don't ever really stop going to the doctor. They need continued support to manage their symptomology. And with an autoimmune condition, what we know is that there are flare-ups. And so maybe a treatment plan is working quite well, but then at 6 months or 8 months down the road, they have flare-ups. And so instead of checking in with the doctor every 2 or 3 months, like is their norm, they end up going a lot more frequently to help manage again the symptom flare-up. Much is the case, I think, with some people challenged with mental health concerns or relationship concerns. Sometimes they come in with a problem, kind of like a broken ankle, that can be resolved pretty darn quickly, and they exit therapy and they don't return and they don't have long-term implications. And other times people come in with mood or relationship challenges that seem to be a little bit more long-term. Maybe in the beginning, there's a lot of care up front. There's frequent meetings. Maybe I'm meeting with them every other week, every week, and then we start lengthening out meeting times. So we'll meet every 3 months or every 6 months. But when there's a flare-up, they come and check back in, and maybe we meet a little bit more frequently. So just because someone's been in therapy for 3 years doesn't mean that therapy isn't successful. Maybe that therapy is what allows them to maintain a sense of balance, whether it's with mood or whether it's with relationships, and that those check-ins allow them to have a certain type of success around the symptomology that they experience. So I hope that it's been helpful. I don't know if you're considering therapy, but if you are, I think that from the outset, it's really difficult to ascertain, are you going to be someone that comes in for 1 session, 5 sessions, 8 sessions, 16, or tends to make therapy a part of their overall, plan for well-being and for care management. I hope that it's been helpful to at least consider different approaches around time frame, what they mean, what it looks like. I know that everyone, wants things to change more quickly, and I can certainly appreciate that and have compassion for that. And if I had a magic wand, believe me, I would want to use it because it would allow people to resolve things a lot quicker. But some problems aren't those that resolve. Some problems are problems that we need to live alongside with some occasional flare-ups here and there. So thank you for tuning in. If you don't want to miss a video, feel free to subscribe, and I hope that this finds you having an absolutely beautiful day. Thank you.